Welcome to this special edition of Daily Vet Life, where we're bringing you short interview synopses of presentations from the 2021 AAEP convention. These special editions are brought to you by Zoetis. I'm Kim Brown, editor of Equine Management. In this episode, we're talking to Dr. Laura Javsicas, VMD, DACVIM of Rhinebeck Equine in New York, on management of the neonate in the field. Thank you for joining us today, Dr. Javsicas.
Thanks so much for having me.
Well, we really just would like to ask you to cover the key points that you and your co-presenter, Dr. Ernie Martinez of Kentucky, discussed during this AAEP convention table topic.
Sure. We covered a lot of topics during our session and had really good discussion. I now work predominantly in a hospital setting, but do see foals in the field, consult with our ambulatory team who sees them in the field every day, while Dr. Martinez works exclusively in the field. And so we had a lot of good information from both the hospital setting and field to apply to horses in the field and neonates in the field specifically. So a lot of general foal management topics were covered. There was a lot of interest in the administration of plasma for prevention of Rhodococcus equi. There's a relatively new study showing that giving 2 liters of plasma rather than 1 within the first few days of life may provide a more appropriate level of antibodies to help prevent infection from occurring, because we know that infection occurs at a very young age in these foals, and Rhodococcus continues to be one of the infections that we battle the most with in our foal age group, and particularly as we are starting to see more resistance to Rhodococcus, to resistance of Rhodococcus to various antibiotic treatments that we have. Along those lines, we also just talked a little bit about monitoring foals for disease and the importance of taking temperature regularly on farms. I'm a huge advocate of farms taking temperatures to help screen for disease. And it can be the first indicator that there's a problem. And specifically with Rhodococcus, it tends to tell you when there's a foal that is clinically affected rather than one that just has a subclinical infection. But back to the neonates, we had good discussion about umbilical care and prevention and treatment of infection, from when you dip, how you dip it, how the cord is torn, which I think is very important. And Dr. Martinez and I both prefer a dilute chlorhexidine solution for initially dipping the umbilicus because it maintains activity in the face of organic debris more so than iodine-based solutions. Also, I think it's important that umbilical cord is stretched and breaks either naturally or that we help it to stretch and break rather than cutting the cord, because it tends to not shrivel up as it naturally would, and I think can lead them to be more susceptible to umbilical infections. We discussed the importance of ultrasound of the internal umbilical structures when suspicious of an infection, which might be because the foal has a fever or a septic joint, or even just a high white count on routine screening. And there are some resources out there, which we provided a link to the attendees for ultrasound references for those internal umbilical structures. And then in terms of treatment for umbilical structures, both Dr. Martinez and I start with a conservative medical approach with antibiotic treatment that gets good penetration into those structures. I like a combination of Equisol and rifampin because it's easy to dose appropriately in a foal, is oral, fairly inexpensive, and does get good penetration, broad spectrum coverage into those structures. And then I follow that up with a recheck of blood work and ultrasound to see if the ultrasonographic appearance is improving after about 7 to 10 days of treatment before deciding if that foal may need surgical intervention to remove those remnants. There were also a lot of questions about treating and preventing diarrhea in the foal. Huge problem right now in central Kentucky with rotavirus B. And it is one of those things that can be very, very hard, I think, to manage in the field, because I'm at a great advantage in the hospital because I can monitor electrolytes and acid-base status very closely and can have the foal on continuous fluids held off the mare for 12 to 24 hours, which I think can be very helpful in managing some of these cases. So that's more a reason for referral than how to manage in the field. But I think it's an important thing to note that sometimes those cases are definitely best managed not in the field. However, there certainly are situations where that's not an option for people. And so I think monitoring the foal's attitude, appetite, how well they're nursing, and looking at those electrolytes and acid-base balance, if possible. That does require running a fresh blood sample. The typical recommendation is within 30 minutes if the sample is kept on ice. So that's not always possible, but as we get more and more stall side monitors, it makes that a little bit easier. Because one thing to be aware with those foals is that particularly if they've had diarrhea for a few days, they can start to lose a tremendous amount of bicarbonate and can become very, very depressed from that and may require bicarb supplementation, which can be done orally with a mixture of baking soda or with IV bicarb added to their fluids. But you need to be careful with how much you're giving them. The other practical tip we talked about with managing diarrhea foals is that a lot of times they become very, very thirsty because they're dehydrated, and then they drink a tremendous amount of the mare's water, and they can dilute their sodium and chloride levels that way and can actually become quite neurologic if they get hyponatremic enough. So I recommend to people that they add electrolytes to the mare's water buckets or elevate the buckets so the foals don't have access to the plain water, because that can help prevent those electrolyte abnormalities from occurring.
Part of the world's leading animal health company with a 70-year legacy, Zoetis Equine is committed to providing horse care products and services that veterinarians and their teams can count on. With trusted vaccines such as Core EQ and FluVax Innovator, leading diagnostics like the Staple Lab stall-side SAA blood test, and the #1 vet-trusted equine sedative, Dermosedan, and a portfolio of regenerative medicine devices that includes ProStride APS, Zoetis is always by your side. Be sure to follow Zoetis Equine on Facebook and Instagram today.
We also talked about management of contracted tendons. I think it can be important to have a good supply of PVC splints on your truck. I'm a big fan of some good cheap PVC. It's fairly light, so the foals can still get around with a splint on. You just have to be very careful with placing the splint with a good Robert Jones bandage underneath to prevent any pressure sores, and this would be for contracted tendons. And in terms of administering oxytetracycline, which can be very, very helpful, the key thing is that the tendons have to be under stress after the Oxytet is given. Oxytet alone is not a magic cure and doesn't magically relax the tendons. The foal has to be bearing weight on the proper surface of its foot, and that tendon has to be stretched typically with a splint as well in order to help correct the contracture. Now, Oxytet is nephrotoxic, so I always recommend that the creatinine levels are checked. And your typical healthy foal that is only dealing with a contracted tendon and not multiple other issues, they usually tolerate Oxytet treatment very well. But I do like to check their creatinine daily in combination with administration of the Oxytet, if that's what needs to be done in a field setting. I do typically give Oxytet in a liter of fluids as well, so they're at least getting a little bit of additional hydration, and it also helps decrease the risk of reactions to the administration of the Oxytet. The foals that I see that become severely azotemic after Oxytet are typically the ones that are not nursing adequately and are dehydrated, so their kidneys are at higher risk of damage from the medication. And that can happen pretty easily if they're not able to stand because of the contracture and therefore aren't nursing adequately. And then the other thing I worry about these foals, or that I see a lot in these foals, is that often the farms have been bottle feeding them because they're not able to get to the udder. And if they're not a very strong, healthy foal, may develop aspiration pneumonia from the bottle feeding. So I think it's really important to assess their suckle reflex, their overall neurologic status. It's not uncommon that there will be a slight dummy foal that also has contracted tendons, and I'm very, very quick to place a feeding tube rather than try to bottle feed those foals.
Having worked on a thoroughbred nursery early in my career, please tell the grooms, do not cut the tips off the nipples because the foals aren't nursing fast enough for them.
Oh my gosh. Yeah. Having the right bottle nipple combination is very important. So we discussed neonatal isoerythrolysis and how to prevent and treat that. I do think the antibody screening of the mares when they're ideally about 2 weeks from foaling can be very helpful. And then typically we recommend, if they are positive, the foal is held off the mare is milked out, and the foal is provided colostrum from a tested source, ideally, at least an alternate source other than the mare, and then is fed through tube or bottle if deemed safe, until that mare has no colostrum left. And that can best be determined by a jaundice foal agglutination test being performed, which is essentially a cross match between the mare's milk and the foal's blood to make sure that there's no reaction. That can also be done initially to see if the foal is at risk from nursing, because if it's negative, then the foal should not be at risk and can go ahead and nurse from the mare, which is certainly the easiest option for all involved. There is a lot of interest and good discussion. Dr. John Madigan from UC Davis was actually in attendance, and there was a lot of discussion of the squeeze foal technique, and he was nice enough to demonstrate that for us. And so basically, the theory behind this is that foals may not make the right transition to extra-utero life, and that they have abnormal levels of neurohormones circulating in their system, and that if you administer these compounds to foals, they will act like a dummy foal. And so the theory is that if we can basically mimic the process of going through the birth canal, that may help these foals make more of a normal mental transition to extra-uterine life and increase their ability to find the udder and nurse. And so it's a very simple procedure. There are very good videos available online, and also some good resources on Davis's website that has good diagrams as well that shows how the rope should be placed. Now, the big caveat here is that you really need to make sure the foal does not have any fractured ribs first, because because the rope goes directly over their rib cage, and you don't want to be pulling on non-displaced rib fractures and causing them to displace and potentially puncturing vital structures. But typically it's very similar idea to casting a cow as well. One of the things I think is really cool about this is you can also use it for restraint. medication-free, drug-free restraint. So if you're just administering plasma to the foal or placing splints on the foal, it can be very helpful with that to help keep the foal quiet during that procedure. It's great for mildly affected dummy foals. I tend not to see a lot of those foals because they typically are getting treated on the farm. And so I get a lot of questions from clients and on social media about, are we using this on our dummy foals here? And it's very, very case selective. When they're severely affected and really, struggling to maintain their blood pressure, having seizures, I'm not using it on those foals at that point. But if it's just a mild ambulatory foal and they just can't figure out how to nurse and are sucking on the walls, then I think that it can be helpful in some of those situations.
So, Dr. Javsicas, can you tell me, I'm interested in the diarrhea because, having been on thoroughbred farms a lot when I grew up in Kentucky and working on them, what is the procedure now for working with foal diarrheas as far as, what do you give them and what are you testing for?
One thing that's really important with all these foals is to make sure they have adequate passive transfer of immunity. So we're looking for an adequate IgG levels at birth. And then there are a lot of the plasma companies now make plasma that has specific antibodies to one or many different diarrheal pathogens. So our Clostridial organisms, rotavirus, etc. There is not a lot of data to back up that this is helpful, but some farms that have endemic problems with a given pathogen, which is often Clostridium or rotavirus, feel that these products may be helpful. And so some farms are routinely administering what we kind of think of as designer plasma. So plasma that has adequate antibody levels to help if they do have failure of passive transfer, as well as antibodies against a specific pathogen or solely against that specific diarrheal pathogen. So it would be great if we can get some more literature to look at whether or not that is helpful. It's of course a hard thing to study because those organisms tend to vary from year to year in terms of what the prevalence is, often based on environmental conditions. But it would be great to have more information on that. From a testing standpoint, I use a lot of PCR diarrhea panels. It's become so fast and easy, and you can screen for a tremendous number of pathogens all in one sample. However, I think it's really important to not over-interpret the results because our PCR tests are so very sensitive. And so Clostridium, I think, is the best example of that and probably the most confusing to interpret because the PCR tests are testing for the DNA of the toxins that are produced that cause disease. So you know that those toxins or enterotoxins are there, and there's a few different Clostridium perfringens enterotoxins that may cause varying levels of degree, but you don't know necessarily how relevant that positive test is and if you've got a large amount of those toxins present. So there is still a place for the ELISAs for clostridial toxins also, but on an individual full basis, in some situations that may be academic, and for me, it's often enough to say, okay, they're positive, they're PCR positive for these clostridial toxins. I'm going to treat them as if they have Clostridium. And I know that they don't have Salmonella, which is also handy to know from my PCR test, and not worry so much about doing ELISAs as well. But if I'm dealing with a farm outbreak type situation and I really want to know what's going on in multiple foals and really get to the bottom of what the relevant pathogens are, then I may need to do additional testing. But it's really great to be able to send out one test and get PCR results for, a whole list of organisms. The other thing to be aware of, though, is that with rotavirus B, there are a lot of labs that are not yet able to run PCR tests for that. So the standard rotavirus PCR is just testing for rotavirus A, which is also what is in the vaccine that the broodmares get. The rotavirus B, there's only a few labs out there that are doing that. So you just have to be aware of what exactly is getting tested. And University of Kentucky, the Gluck Center, is doing a lot of research right now on rotavirus B. So hopefully there will be more information coming and more help with preventative measures as well.
Well, that's great. Well, we really appreciate you being with us today, Dr. Javsicas. And a big thanks to Zoetis for sponsoring this podcast, because as we all know, we can't make it to every one of the talks at AAEP. So it's fun to have this. Is there anything else that you had wanted to add? Or are you good?
No, I think that's it in terms of highlights. So thanks so much to you and to Zoetis for having me.
Well, we really appreciate it. And to our audience, make sure you listen to all 12 of these special editions of the Daily Vet Life podcast. You can listen on your favorite podcast network, or you can go to equimanagement.com, and we'll have an article and a player for each podcast on the website. And that way you can listen to all of them there if you want. Thank you again for joining us. And thank you again, Dr. Javsicas, for being with us.
Thank you.